Thank you very much. Further debate. Member for Lanark, Frontenac, Addington? Lennox and Addington.
Thank you, Speaker. Speaker, it's a pleasure to speak about Bill 45 today. I don't know if the title of the bill is quite correct. It says about making healthier choices in all aspects of the bill. And I want to just let people know I'll be referring to a number of studies during my debate. A number of them, they're all from esteemed and thoughtful organizations. One of them will be from an addiction research report. And there's 5 authors on that report. They're from the Cancer Research UK Health Behaviour Research Centre, the University College London, UK, Department of Clinical, Educational and Health Psychology at the University College London, the Maastricht University Medical Centre, and a host of high-caliber professional organizations that have done significant research into areas that this bill impacts. And I'll start off by saying, we often hear this phrase from governments, not just this government, but from many governments, that they're going to make decisions and policies based on science and on evidence and not ideology. We hear that all the time. Well, if they're true to their word, Speaker, I'm going to ask them to actually look at the science and look at the evidence. And not only that, I want them to look at their own legislation. The focus of my interest here is the electronic cigarettes. The electronic cigarettes are often used as a smoking cessation device, something to help people make healthier choices. That is indeed their purpose for most people. The Smoke-Free Ontario Act, I'll read one section of it. The Smoke-Free Ontario Act, this act applies to tobacco in any processed or unprocessed form that may be smoked, inhaled or chewed, including snuff, but it does not apply to products intended for use in nicotine replacement therapy. So the Smoke-Free Ontario Act does not apply to those products that are there to help people quit smoking. Right? However, that whole section of the Smoke-Free Ontario Act, which precludes smoking cessation devices from its authorities, is made redundant or put into conflict with Bill 45, because Bill 45's purpose is to prevent people from using smoking cessation devices, electronic cigarettes. And, Speaker, I have a list of 38 different studies here from around the world that all demonstrate that electronic cigarettes are the most effective way to reduce smoking. They make nicotine patches look like, a plaything. Over 10 times more effective in most cases are electronic cigarettes over nicotine patches. And it may be important for the members to recognize as well that often nicotine patches are prescribed and are often paid for through public prescription programs. But electronic cigarettes, of course, are not. There's no cost to the taxpayer on electronic cigarettes, but there is for nicotine patches. And, these 40 studies that I have here, the American Council on Science and Health, the International Journal on Environmental Research and Public Health, UK's Medicines and Healthcare Products Regulatory Agency. These are not fly-by-night organizations, Speaker. These are top-shelf academic studies. The Clarkson University Centre for Air Resources, the New Zealand Health Department or Health Ministry, the Roswell Park Cancer Institute in Buffalo, New York, the American Association for Cancer Research. The list goes on and on. There is science and there is evidence that electronic cigarettes are a healthier choice, but they are being banned and treated much like real or tobacco cigarettes. So I would like that to be raised up in the debate this afternoon. And I can, here we have the science, but we all have the anecdotal evidence. We all have heard and all probably know people who have used electronic cigarettes to quit smoking. A good friend of mine, first person that introduced e-cigarettes to me, he bought one about 2 years ago, and he has not picked up a tobacco cigarette since. Right? There's the Oxford Medical and Health Journal, Nicotine and Tobacco Research, found that using an e-cigarette does not have toxic tobacco-specific combustion products. Right? There's a raft of evidence, and I just don't understand why this government would want to limit people's ability to make healthier choices, which they're doing here. The Cochrane Library, in their study in December 2014, the study showed that people who use electronic cigarettes were more likely to cut down the amount they smoked by at least half, right? Rather than people using a patch, and showed that electronic cigarettes containing nicotine further increased the odds of reducing smoking. And just for context here, a lot of people may not understand this for smokers who have gone to electronic cigarettes. We all know that you can't go into a pub or an office or wherever and light up a cigarette. But historically, those vaporizers were allowed to be used. If you're driving your truck at work and you're trying to quit smoking, it's against the law to have a cigarette in your truck, in a delivery truck. But you were allowed to use a vaporizer. Now, you're not allowed to use a vaporizer in the truck with this bill, when this bill passes. You're not allowed to use it anywhere indoors. So I say to you, Speaker, through to the House, that was the reason why a lot of people found e-cigarettes valuable and a good smoking cessation device. Now, if you're not going to be allowed to have a vaporizer in your truck or in your some other indoor covered area, if you're going to have to go outside into the cold anyway, or into the rain, well, why the hell not just have a real cigarette then? Okay? That's really, there are some unintended consequences here. And I think the parliamentary assistant recognizes there's, and I think the Minister of Northern Development might recognize that there, this ideological driven ban on electronic cigarettes may have very, very harmful consequences and actually keeps people on tobacco longer than they otherwise would have. Okay? And that would be a truly a travesty and a shame, Speaker, that government goes out and creates a bill that prevents or is a disincentive for people to cease smoking. I'm going to be interested in listening to this debate, Speaker. I want to hear some members from the Liberal side challenge these 40 studies that I have, to challenge the evidence, the scientific evidence, and demonstrate. I'll be looking forward to see if they can demonstrate to me that there is justification in preventing people from quitting smoking using electronic cigarettes. If they can't, I'll be voting against this bill for that one reason. If this government is bringing forth laws that will prevent people from quitting smoking, I will oppose it and vote against it. Thank you very much.